By the year 2050, it is predicted that 13.8 million Americans will be living with Alzheimer's dementia. This is double the 6.9 million that the Alzheimer's Association currently predicts to be living with this disease. In just 25 years, the population living with Alzheimer's dementia is predicted to double. This issue has become increasingly more prevalent than in the past, and addressing it will allow for better American health. In the past few years, there have been several issues regarding treatment options. Pharmacological interventions, meaning the use of drugs to treat symptoms in patients, have been shown to have no effect, and in some cases can even have a negative effect, as seen by changes in mood and behavior in patients. Additionally, when one singular non-pharmacological intervention has been implemented, there is a limited effectiveness because there is not a strong enough effect on the brain or body. The biggest issue with more and more of the population developing this disease is developing effective interventions. Developing new interventions can include things like creating new medicines, but it can also entail combining forms of treatment that have been already proven to be effective, such as music therapy and exercise therapy. But when examining these combined interventions, the question is posed: to what extent are music-based exercise interventions on the prevention of dementia effective? Based on my research, I have discovered that combining multiple forms of interventions is more effective than just one form of intervention alone on the prevention of cognitive decline. I connected this question to the stimulus material in two different ways. In Johann Norberg's article, False Nostalgia, Norberg explains the effects that nostalgia can have on human memory. Additionally, I discovered that the form of music therapy can use old music to instill nostalgia in geriatric patients. According to the Alzheimer's Association's report, an aging population leads to an increase in cases of dementia nationwide. So when examining new forms of intervention, questions arise about how to prevent this issue. Thus, music exercise therapy arises as one potential intervention for this disease. Johann Norberg explains that as people age, they feel a strong longing for the past. This longing can be intensified by several different lifestyle changes, such as aging into adulthood or retirement. Additionally, nostalgia establishes a sense of self and identity in an individual. One way to facilitate nostalgia in elderly patients is through the use of music therapy. Diana Vitas, research fellow at the University of Queensland, expresses that music can help patients reminisce on the past despite struggling with verbal communication and memory. So when we combine interventions, greater results are yielded because there is a larger effect on the brain and body. Roberta Forte et al. Expressed that music increases the excitability of neurons in the brain. This means that executing movement for patients with dementia diseases such as Parkinson's becomes easier and less strenuous on the patients. Using music exercise to prevent the onset of dementia and to lessen symptoms can be very beneficial. Unlike pharmacological approaches, these interventions have been shown to improve mood and behavior in patients. Furthermore, this intervention allows for great benefits to the body due to the physical effects of exercise on the body. When implemented over a long course of time, this solution can even cause physical altercations in the brain. These physical altercations can include an increased hippocampal size and increased neural activity. Both of these factors work together to prevent memory loss in elderly patients. The combination of music therapy and exercise therapy increases sensory and motor functioning in elderly patients. Occupational therapist Patricia Houston asserts that forms of this intervention, such as dance, are superior to other treatment options because they allow for complex sensory motor activity. This means that there is both physical and cognitive training that is being applied when this solution is implemented. Additionally, forms of treatment such as dance allow for creativity and self-expression in patients. If a patient feels they are able to express themselves better, they're more likely to engage with the world. They are also able to process their own emotions and the information around them to a much better extent. Managing emotions is vital in patients with Alzheimer's because it affects their agreeability and willingness to accept treatment. By boosting creative and emotional response, other treatments begin to become more effective. The benefits that music exercise therapy provides on both the human body and mind are great. The most significant effect is music and exercise's ability to decrease memory loss with age. In a study conducted by Masayuki Sato et al., it was discovered that men who walked 0.25 miles per day experienced a 1.8-fold excessive risk of developing dementia compared to men who walked at least 2 miles per day. Music and exercise combined can help overcome the brain atrophy attributed to aging. Sato and his team additionally found that over the course of 6 months, those who performed aerobic exercise every day had an increased hippocampus volume of 2%. The hippocampus is the portion of the brain responsible for memory and processing, and it has been shown that it is physically possible to grow this region of the brain. By implementing this solution, it is possible to reduce the memory loss that occurs with age. This solution does have a few limitations that make it potentially difficult to implement on a large scale. For one thing, it can be difficult for hospitals and care centers to find the space to perform this therapy. Forms of treatment such as dance require large spaces to conduct, and many facilities are not able to do this. Additionally, it can be difficult to completely switch the treatment programs that patients are on. If patients are used to a certain type of therapy, it can be hard to implement something new because they might not comply. However, these limitations are simple to work around, and the effectiveness of music exercise therapy outweighs these difficulties. Because of its complexity and vast benefits on the human brain and body, the benefits that the combined intervention of music exercise therapy offer make it a much more advantageous approach to preventing Alzheimer's disease in aging populations than other forms of intervention methods.
Okay, I have a few questions for you, a couple of them. How did some preliminary information you gathered inform your research?
Yes, so I have had several family members who have developed Alzheimer's dementia as they aged, and I also have several family members who work in healthcare and work with patients who have dementia diseases such as Alzheimer's and Parkinson's. And growing up and living in this world has really taught me about how these diseases can affect people. And additionally, before I was able to understand this intervention method fully, I had to understand completely how these neurodegenerative diseases affect the brain.
Okay. And my second question for you, how is your conclusion in conversation with the body of literature or other research sources you examined?
So my conclusion was that this solution is greatly effective and more effective than other forms of intervention, and a lot of the literature I found supported this conclusion because it described the physical ways that this solution can change the brain and the body, and this demonstrates how effective this solution is.